Hello, Akwesasne. I'd like to share with you some information from the Department of Health on our activities that may be of benefit and of interest to you. Before I start, as you notice, I'm wearing a Red Wings sweater. This is in honor for the individuals that had passed away in the bus accident from Humboldt, Saskatchewan. We at the Department of Health and the entire Mohawk Council of Akwesasne want to acknowledge, and we understand the pain and the suffering that they're going through, and we're sharing it with them as well. Thank you. With respect to the Department of Health, a couple of items we've been dealing with over here, along with a number of other departments from the Mohawk Council, is the development of the Recreational Cannabis Task Force. This task force was developed to try and engage the community on the positions regarding the cannabis recreational use. I'm glad to say right now that the survey that was conducted is now closed. It is going through analysis, and we will be able to provide further information in the very near future. Just want to thank everybody that's been involved in that activity, and we know that the information will be useful for the determination by the Mohawk Council of the direction we will be going in the area of cannabis. With respect to our activities for Provincial Health Services, I just wanted to share with you that within Ontario we are doing some additional activities. The main thing we're looking at right now is to improve our electronic medical records. We've now set up agreements with the Government of Ontario to work on developing better connections. So it's with the Ontario Connect institution where we will be tying in so that most information that people now get regarding diagnostic services outside of our communities will soon be able to be read by our own health practitioners here. It's not tomorrow, but we are looking at that, and hopefully we'll be able to give a time and a date when that will come through. We are in the discussions and we are in the stages of implementing this. Also had a discussion too with the Ontario Children's Treatment Centre located in Ottawa. We are trying to work to provide greater services for diagnostic activities that require our people to go out of the community. So we will be filling you in on that one as the further discussion goes on. Our intent is to ensure that if you require the services from Ontario, that we'll have better access to make sure that those will be provided to you. With respect to those that are living on the Quebec side, we've been able to start up this further discussions with the Quebec Health Ministry, and what we are doing is we are opening up now new ways to get diagnostic services coming through for our people. Although we do the initial activities here, our screening has to be done within their system. And I'm really glad to say right now that we've had success for people that are requiring services with QHIP cards to be able to go into the Barrie Memorial Hospital. And we are going to be trying to further expand on that so that the services that are going to be available will be reachable. We've also had the opportunity to discuss for our children. We've been talking with looking at how can we ensure that there's greater audio and speech referrals that will be accepted either at Barrie Hospital or for the initial review, and then if required to go on to the secondary or tertiary hospitals beyond that, most likely the Montreal Children's. Again, this is a work in progress, but we have begun this process. We are going to make sure too that we can come back with further results and inform you when all of these things will be happening. I think the other one that I wanted to share with you here is we've had a lot of capacity building within the Department of Health. I'm very proud to say that we have 12 people that are mostly program managers involved in what we call a Certified First Nations Health Managers program. I'm really proud to say that Akwesasne will be the first First Nation in all of Canada to have all of its health program managers certified. Certification is excellent because it allows a standard that has been reached, and it's not only been reached at a director level of health, but it's also been reached at the program levels. I honor those 12 people. Their graduation from the program will be in the fall, and presently they're just about completing the process. And I do want to honor all of those people that are on my staff that have taken that, and I look forward to the support that they're going to give with all of the new knowledge and skills that they have to make us a better workplace. Thank you very much. Keith Leclaire, Director of Health, Mohawk Council of Akwesasne. Ona.